My question is about the private insurance industry, not the government. I'm not a supporter of the public option. I'm a supporter of single-payer health care, Medicare for all. The private insurance industry is motivated by profit and greed. They do nothing at all to improve our health. They're taking record profits. There is no reason for them to be involved in health care. We have single-payer police and fire departments. We have single-payer schools. We have single-payer armed forces. It is not socialism.
Okay, I think your question is, and your time is up. Your question is,
why is the insurance industry in the healthcare industry at all? Why do we need private insurance in the healthcare industry?
Okay, that's a very appropriate question. Who goes first this time? I forgot. Kasai, thank you for the question.
And that's really the core of this debate. The question is this: is the government the right entity to run healthcare, or should we leave it to the private sector and let competition take its course? I don't think anybody denies the fact that we need a reform. But having the government involved and handing them almost one-fifth of our gross domestic product annually is not the answer. When you think about it, the government really over the history, or modern history, has not done a good job running programs. You know, you mentioned Medicare, for example. Medicare is a great program, and a lot of seniors in South Dakota and across the nation benefit from it. A large percentage of them have to have a supplemental program. They have to go to an insurance company to buy a supplemental program to basically provide services that Medicare doesn't cover for it. Another thing, as a matter of fact, in the Social Security and Medicare trustee report of 2009, Medicare is $39 trillion in the whole unfunded liabilities. So do we really want to reward that by adding more to what's already in the hole?
Firstly, to answer your question, maybe not directly, but there are no efforts right now to obtain a single-payer system, anything similar to what Canada has or what's in Great Britain. But your question regarding private insurance, I think that many of us in Congress are in agreement that private insurance plays a very important role. It covers the majority of people. And there are many innovative ways that private insurance has come up with to cut their costs, to improve care and coordinate the quality of care that people are receiving to ensure that their customers are happy. Unfortunately, the private sector does not reach out to everyone, and there are people that fall through the cracks that don't qualify for a public program, but are denied coverage or cannot afford the coverage currently offered under the private system. And so I do want to say that there's no single payer system under consideration in this effort, but this effort is to reach out to those people who right now are not being served by private insurance.
Thank you, Megan.